So we also see depressive disorders at a very high rate. And people have written about depression for years because really a mystery to many how these symptoms can occur and how someone can be so depressed that in their experience they have no ability to remember what it's like to feel better again. And often when they feel better, they can't remember how bad it really was when they were in a depressive episode. So depression is a word that doesn't quite explain the whole spectrum of the experience of having depressive episodes. Because we know with depression people have fatigue and quite a bit of physical complaints about how they have no energy, how they feel run down and tired. So depression may affect people on kind of an emotional, psychic pain level, on physical fatigue or energy level, in terms of appetite disturbance, weight change in either direction. It's something that overtakes the entire body. And we notice depression when students come to us talking about thoughts that are pretty negative. Their thoughts tend to be extreme. Their thoughts tend to relate to things going poorly in the future, a little bit like anxiety, feeling bad about themselves and about the world and the future. It interferes with relationships because it's difficult to be with someone who's depressed and not feel some of that pain. So relationships are much more likely to fail to survive or thrive when one or both partners is experiencing depressive episodes. It affects health. People present more at student health or at health settings with multiple physical complaints when they're depressed. And often you can treat those individual complaints one at a time, or if they seem to cluster and you're able to recognize this is about depression or depressive episodes, we can intervene and more effectively manage that by treating the depression, because then physically they tend to be better. People complain of sleep disturbance, appetite disturbance, and inability to manage or balance work and school. So it's one of those disorders that's pretty pervasive, and through time, as it gets worse, people tend to forget just how bad it's gotten. So some of the signs, again, that I've already mentioned, being sad, which is one part of depression, but not everybody experiences depression in the same way. So students of mine often say, I'm not depressed, I'm not crying, I'm not upset about anything, there's nothing wrong, I shouldn't feel bad. But they have the experience of sadness, of fatigue, of fear about the future, a lot of guilt. I'm not a worthy person, I don't work hard enough. Maybe some of these sound familiar. A loss of interest in activities, nothing feels good anymore, nothing tastes good, music doesn't sound as good, and often there's even a lack of interest in sex. There's decreased energy, fatigue, psychomotor slowing when you notice friends or people you know that hang out of a chair, can barely get up and walk. Everything seems to slow down. Difficulty with concentration. I hear this from students. I can't remember anything. I have to read things 4 times for it to sink in. Because when you're significantly depressed, your brain has much more difficulty concentrating and memorizing. There's some restlessness or irritability. A hallmark sign is the early morning awakening. People waking up at 4 a.m. thinking, I don't have to be up yet, but I can't get back to sleep. Changes in appetites, when you see weight loss or weight gain. And even thoughts of death or suicide seem to come out of nowhere. Suddenly, people will tell me, I'm thinking about life and death, and why I should be alive. And sometimes passive suicidal ideation. Students tell me, I'm not going to go out and kill myself, but if I got hit by a bus tomorrow, it wouldn't be such a big deal, or it wouldn't be a big loss. That sense that why do we live and what's our purpose? So depression is something that affects many of us. It's thought of as the common cold of mental health treatment. So we see depression quite a bit, and often it occurs with anxiety. The depression can drive anxiety and keep that alive, and I've seen also long-term anxiety result in depressive episodes. So it goes either way. Luckily with treatments, we can treat depression and anxiety together with the same medication. And maybe it doesn't matter which one comes first. Many of us will have one or two depressive episodes in our lifetime, but when people begin to have repetitive, cyclical episodes of depression, we intervene because our fear is that they're going to get worse, they're going to go deeper with each episode, and the length of those episodes is going to continue to increase. Just the way that we as human beings adapt to seizures. We have seizure disorder, migraine headaches. As you experience these episodes, neural pathways are laid down that support the continuation of those episodes, and you want to intervene and block that. Women report depression at twice the rate that men do. We're not sure why that is. That has to do with physiological differences, hormonal differences, a bias in the medical field. They're more likely to pick up on women who report depression, or that men mask it and often present as substance abuse and anger issues instead of being able to identify their feelings as depression. So a number of people struggle with episodes. Not all of them seek treatment. And 50% of those that don't get treatment are going to have recurrent episodes, which is not good. But 72% of people with depression continue to work and go to school. And I see people who continue to push and try their hardest to get through the quarter. When they're depressed, they just cannot do as much. 55% are not diagnosed or treated by a family doctor. So it can be missed.